a show that tackles the big issues affecting the BVI and the rest of the Caribbean. Searches for answers to today's big questions and gives viewers a unique perspective on developing stories. Follow the big story with me, Kathy Richards, only on JTV. This show is brought to you by the National Bank of the Virgin Islands and Digicel, Cyril B. Romney Tortola, Pier Park, and Nagico Insurances, Banco Popular, Simply Secure, and NV Salon, Spa, Nail, and Barbershops.
You value traditions.
Today.
You value music. You value education. Family.
I love you.
Service.
Thank you. You're welcome.
Love, life. At Popular, we're committed to you and everything our community values. For the things you value the most, count on us. Popular.
Stop.
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 Think.
Before you act.
Before you act.
Think before you act.
This is The Big Story. I'm Kathy Richards. I want to thank you so much for joining us for this edition. My guest is no stranger to this platform. He's been here once before, Professor Ian Cummings. Professor Cummings, welcome again.
Thank you very much indeed, Kathy, and thank you for the invitation to be with you.
Okay, for those who would not have seen the previous interview we had with you, could you refresh our memories as to your role in the overseas territories as it relates to COVID-19 handlings?
Of course. So my role is that I'm the UK ambassador for healthcare to the overseas territories. So I look after the relationship on matters to do with healthcare between the UK and all our overseas territories. But specifically over the last, I suppose, 18 months now, I've been working almost exclusively on COVID, helping territories with any support such as vaccination, but also working on developing laboratory testing capacity and capability, helping with any epidemiological support where that may be needed, and also looking at what best practice we can identify in the overseas territories that we can share, either to take back to the UK or indeed share from one territory to another.
Okay, and in your first visit, which was some weeks ago or approximately a month ago, you made some observations and you had shared those with us. Compare those observations to the present situation.
Of course, before I answer that question, can I just pass on my deepest heartfelt condolences to people who have lost a loved one in the recent outbreak that you've had here of COVID. It's a tragedy to see so many people passing away as a result of this terrible disease. In terms of the difference, well, it's stark. So I was here approximately 6 weeks ago, and we were having many conversations about how as a result of good planning, but also some good luck, that we hadn't seen a significant outbreak in the Virgin Islands. And at that time we were saying that, you know, we hadn't seen much, if any, really serious disease. Of course, things changed very quickly, and we did see a significant outbreak here, resulting in many people being hospitalized, and, as I say, tragically, many people losing their lives to this terrible virus. I think the message that I was giving last time I was here remains. We know that people who have been vaccinated either don't get the virus, or if they do get the virus, they have a much milder form of the disease. Even if people have been vaccinated and they do get the virus, they are far less likely to pass it on to other people. So the best way to protect individuals, to protect population, is by as many people as possible becoming vaccinated. Of course, what I have seen in the time that I've been back is the tremendous work that's been going on with the drive-through vaccination centres, which remain open. And again, I would encourage people to go between 10 a.m. and 4 p.m. and just turn up if they want vaccination. They've got through some phenomenal numbers of people over the last month or so in terms of that vaccination drive, but we're not there yet. We need to get more people protected through a vaccine to help protect the population. As I said last time, there are only two ways in which people can develop immunity to this horrible virus, this horrible disease. The first of those is by being vaccinated, and the second of those is by being exposed to the virus itself and having the disease. That second course of action is very, very high risk. Somewhere between 1 and 2 people in every 100 who catch the virus will die. Somewhere between 1 and 2 in every 100 people who get this disease will die. We can prevent that from happening if people will come forward and be vaccinated.
Okay, your return to the territory in such a short space of time was at the request of His Excellency the Governor John J. Rankin. Why was it necessary for you to return in this quick manner?
Well, so my job is to be available as a resource to go to anywhere where we may be able to find some help. We knew that we had an additional supply of vaccine arriving in the territory, and that's now here and safely in the fridges. We also wanted to see if we could offer any help and support to Dr. Ronald Georges and his team in public health in terms of the epidemiological modelling. And I wanted to continue with some of the conversations about how we could look to encourage more people to become vaccinated. So it's not an emergency visit or anything like that, but it's just the opportunity of staying in touch, staying in contact with people. And if we are able to provide any help, support and advice, then we're very happy to do so.
Okay, one of the things when the virus took an uptick in the territory that most persons were very confident of is that there was very, very likely to have been the Delta variant prevalent among the population that has caused such an extent of damages on the territory. But subsequently, just recently, the report returned that there is no variant of interest. Could you explain, for the betterment of our understanding, what could have been the issue?
So what happens is that the virus can be sent, the samples from people who've tested positive can be sent away to try and identify through a process called genome sequencing which particular variant of virus that is present. Now, I think we need to be careful about saying there is no Delta variant here because we simply don't know the answer to that question. What we can say is that in all the virus samples that were sequenced, Delta variant was not found. So in the tests that have been done, that were done by CARFA, I think out of Trinidad, there was no Delta variant found. But we have Delta in the US Virgin Islands, we have Delta in Trinidad, we have Delta in other Caribbean islands. So we don't actually know for certain that there is no Delta variant here. But I think we shouldn't focus too much on these variants, because it's still a horrible disease, whichever variant of the virus you're actually infected with. It still kills people. It still makes people seriously ill. I think the big difference with the Delta variant is that it's much more easily transmissible. All the data that's coming out now is showing that actually a very short contact with somebody who may already have the virus, if it's the Delta variant, will allow that virus to be passed on to somebody else. So it's much more transmissible than perhaps some of the other variants. But the actual outcomes of catching it are just the same. It's a horrible disease in too many people.
Okay, from your assessment, what are some of the limiting areas and what are some of the applaudable areas that you would have seen in the COVID-19 fight in the British Virgin Islands, save and except the vaccination drives?
So, well, you mentioned the first one. I think the drive-through vaccination centre has been an excellent initiative, and I know that initiative has been well supported by a number of organisations such as Red Cross and Rotary, etc., etc. And I also visited the drive-through in Virgin Gorda over the weekend to see the brilliant work that's going on there. So, as you say, that is a fantastic initiative, and we need to keep that running. We need to keep people to go and not only have their first dose of the vaccine, but go back 4 weeks later and have the second dose of the vaccine, because people are not fully protected until 2 weeks after the second dose of the vaccine. We want to get people fully protected as quickly as possible. So get your vaccine, go back for your second dose of vaccine 4 weeks after you've had your first dose is the first message. The second message is that the protocols that are here in the British Virgin Islands are good. The preparation work that's been done by the government and the Ministry of Health is good. We need to encourage people to make sure they follow those protocols. So wear your masks. Please don't wear your masks as your chin strap. Wear your masks over your nose and your mouth. Masks prevent transmission of this virus. So please wear your mask. Please wash your hands or use an alcohol hand rub. The actual virus, the outside of the virus, is made up of a fatty-like material, and alcohol destroys that and kills the virus instantly. Soap destroys that and kills the virus instantly. Keep your hands clean. You don't know if you're touching a surface that somebody else has touched, perhaps having coughed on their hand. So wash your hands, use your hand rub, use your face masks. Social distancing, particularly, it's important everywhere, but particularly important if you're inside. Make sure you keep that distance from other people so you're less likely to pick up a virus if somebody else has got it. So those protocols, those regulations are in place. They will work. We know that they work to suppress the disease. There's a phenomenal amount of testing being going on in the British Virgin Islands. And that is fantastic to see how the laboratories have been able to ramp up that testing capacity so you know what you're actually dealing with. Of course, the more people you test, the more positive cases you're likely to find. So the bigger the percentage of the population, the more people perhaps who are asymptomatic you might identify. But that's good, because some of the highest risk people in this pandemic are people who are positive but don't know it. Because those are people who are mixing, who are producing virus, their body's working like a virus factory, pumping that virus out. And if they don't know they're positive, they'll be mixing and mingling and passing the virus on to other people. So your high levels of testing are really good in identifying those asymptomatic people who may be producing the virus to help keep them in isolation, to help keep other people safe. So, I think there's tremendous work being done here. I think the work that's being led by Dr. George is sending samples across to CARFA to identify which variant you're dealing with. And we're also looking at potentially an arrangement with Bermuda to allow some more of that sequencing to be able to be undertaken than perhaps CARFA are able to do, because they're constrained in terms of volume. That will give us more and more information on what we're actually dealing with here.
Okay, two other things I would love if you can touch, and I'll say them both so that I do not forget the one. One is the growing concern about the type of masks that are being worn by persons on a large scale, and those are the cloth-made ones as opposed to the surgical or medical type that is sold. The other issue I would love for you to talk about is the growing fear that persons have that is keeping them from seeking medical attention.
Yeah, so two really important issues. And I think in terms of seriousness, the second one in particular, I want to address. But let me deal with the masks first of all. So first of all, any face covering is better than nothing. Okay, so wearing anything over your face is significantly better than just not bothering, not using anything at all. The best level of protection you can get are the blue, actually other colours are available, but the surgical, the medical masks that you see. And the reason they're so much better is two or threefold. First of all, they're coated with a water repellent surface on the outside. So if anybody were to accidentally cough or sneeze, or you get some contaminated moisture on the outside of the mask, it's water repellent, so that's not going to pass through the mask in the same way as if you were just wearing a cloth face covering, it might become damp or even wet. The second reason why the medical masks are so much better is that they're not just a single layer. So the one that I have in my hand at the moment is 3 layers of fabric. So what that does is produce an even bigger barrier between somebody's mouth and the outside world. So in terms of both what you're breathing in, it's effectively filtering the air, but also in terms of what you're breathing out, it's stopping droplets from your mouth going further. So wear something would be what I would ask people to consider. But if you can get hold of the medical masks, the water repellents on the outside, the multiple layer masks, then they really are gold standard. They're the ones that we would like people to wear. But not everybody has access to them, and I fully accept that if people are buying them, they are expensive. So whatever it is, wear something, but if you can get them, wear the medical masks. With regard to people not seeking treatment, this is potentially quite serious. So I was up at the hospital last week, and I was hearing stories from people in the emergency department there about just how poorly some people were when they were presenting at the hospital, where the amount of oxygen in their blood was really at a very, very low level. If people are ill, if people are becoming unwell, use the symptom checker that the public health team have developed that's available. That's a fantastic tool, and that allows people to enter their symptoms. That allows us to get back in touch with people who have got symptoms, who have got problems. If you're finding it hard to breathe, if you're out of breath, if you're feeling really unwell, please seek medical help. Do not sit at home and think, oh, I'll just get better. If you've got minor symptoms, that's absolutely fine. But if your symptoms are more serious, use the symptom checker or pick up the phone and explain your symptoms so that we can get help to you. If you are leaving this too late until you become really unwell, then it's less likely that you're going to do as well in terms of recovery.
Okay, great response. And that brings me to the question. You said that you have visited the hospital recently. So I'm guessing, like you did the previous occasion, you had chats with nurses and other medical workers there. Compare the situation from your assessment to your first visit.
Well, clearly the first time that I visited Tortola, there were no COVID patients in the hospital, so it's a completely different environment. I think your healthcare staff are doing a simply magnificent job. It is a really difficult situation because, as well as nurses and doctors being nurses and doctors, they're also mums and dads, and they're also grandparents in some cases, they're also children in some cases. So, they have got their own concerns, their own worries in the outside world as well. They are coming into work to work in an environment with people who they know are testing positive for COVID. Fortunately, the vast majority, I think almost all doctors in the Virgin Islands have been vaccinated, so that gives them a level of protection. Unfortunately, we don't yet have the same amongst nurses. I would strongly advise all nurses who are working here to consider taking the vaccine. I think, as I said last time, I don't necessarily see why people should believe me. I'm a guy who's arrived on a plane from London. People don't know me. Why should they trust me? But you know what? You've got some very competent, very skilled, very highly trained doctors here. And if almost 100% of those doctors have chosen to take the vaccination to protect themselves and protect their families, I think that should be giving a message to the population. So people are working hard, people are working under pressure. Some of our healthcare staff up in the hospital, but also out in the community, have had to isolate because they may have been exposed in the non-hospital environment without PPE to somebody with the virus, and therefore they've had to go into isolation, which puts extra pressure on in terms of the workload. But from what I saw as I walked around the other day, people up there are doing a magnificent job and are providing high quality care to people who need it.
Okay, do you have an idea as to the percentage of nurses that may have been vaccinated?
I don't, I'm afraid. I don't have that figure, but I'm sure that that's a figure that the government or the ministry or indeed the hospital will be able to provide you with, but I don't have that figure now.
Okay, and as you
I know, perhaps just to add, I do know that there has been a vaccine drive at the hospital over the last 2 to 3 weeks, and the acting CEO of the hospital was telling me that she thought the numbers had gone up quite significantly as a result of that vaccine drive. But until this is all collated, because of course some people who are nurses may also have chosen to go through the drive-through as well. So until this number is collated, we can't be sure about what percentage of nurses have been vaccinated, and I certainly haven't seen a figure for that.
Okay, as part of your discourse or advocacy along with working with the governor, is there any opening yet or consideration being given to have other vaccines be brought to the BVI, like the Pfizer, the Johnson & Johnson, or any other?
So, yeah, I mean, I think as I explained last time, the reason that the AstraZeneca vaccine is here from the UK is that at the moment, that is the only vaccine that we can safely get here. So the Pfizer vaccine we have been able to send to those territories that have direct flights from London Heathrow. So it's gone to Turks and Caicos, it's gone to Bermuda, it's gone to Cayman, and it's gone to Gibraltar. All the other territories we've sent AstraZeneca to, because AstraZeneca is stored at fridge temperature. The Pfizer vaccine is stored at -70. The Pfizer vaccine is very fragile. You can't bounce it around too much, you can't vibrate it, or it simply doesn't work when you inject it into somebody's arm. So you've got to be quite careful how you transport it. The AstraZeneca vaccine is more robust, so fridge temperature, and although clearly you wouldn't mishandle it, you wouldn't treat it roughly, but it can take more of a normal transportation than Pfizer. Now, obviously, we're always reviewing this. They are both very good vaccines. There's also the Moderna vaccine that's now becoming available, although we haven't used anything like as much of that in the UK. And bear in mind that what's been coming here to the Virgin Islands is out of the UK stock, so it's coming straight out of the vaccine that we're giving to the population in the UK. So you get effectively whatever we're giving people in the UK at the time. So we've used very little Moderna to date. We've used Pfizer and AstraZeneca as the two main ones. We've given somewhere in the region of 34 million doses of the AstraZeneca in the UK so far. So that's what's here. It's a good vaccine. The World Health Organization's advice is if there's only one vaccine available, everybody should take that vaccine. The efficacy of the vaccine is good, but we will always review whether or not there's any opportunity for us to bring a different vaccine in. So, for example, if we were to choose to start offering vaccination to younger people, perhaps people between 12 and 18, then the only vaccine that's currently licensed to be given to 12 to 18-year-olds is the Pfizer vaccine. So if we were seeking to vaccinate that population, which we aren't doing yet in the UK, by the way, apart from people who are high risk, but if we were to start vaccinating 12 to 18-year-olds, then we would need to find a way of getting Pfizer vaccine here.
What's the number one thing on your report back to your authorities as it relates to the BVI and COVID-19 fight?
So I don't, my job is not to provide a report back to the UK. My job is here to help the Virgin Islands if I possibly can. But the number one item in the report that I'll be leaving for the Premier and the Health Minister is vaccinate, vaccinate, vaccinate. That's how you'll save lives. That's how you'll reduce the burden of disease in the population.
Okay, Mr. Cummings, I want to thank you so much for taking some time out of your schedule today before you leave to speak with us here on The Big Story. And I want to thank you for joining us for this edition of The Big Story. I'm Kathy Richards.